This program is proudly brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Seafort, your best vitamin C supplement from Samuel's Pharma.
It's another beautiful week and we are super excited coming your way with another thrilling episode of Ask Your Pharmacist. My name is Peggy Samuel. Before we get into the nitty-gritty of today, please go on the YouTube channel, subscribe at Dragnet TV, and get updated with any of our episodes. Like, share, comment. This episode is brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana and Tema Christian Eye Center. If you're looking for a facility with a comprehensive eye care treatment, skilled and experienced doctor with ultra-modern equipment, please go to Tema Christian Eye Center located at Tema Community 1 adjacent the St. Paul Methodist Church. Tema Christian Eye can also be reached on 024-371-7468. Tema Christian Eye Center, changing lives through proper eye care. This show is also supported by Seafort, the best vitamin C plus zinc from Samuel's Pharma. Many thanks to our media partners, ETV Ghana and GH1 Television. We are going on a quick break. I'll come back, introduce our location, topic, and our guest pharmacist. Stay seated. I'll be right back.
Are you tired of roaming for your medications and can't find them? Sick and alone and can't get anyone to get your drugs? Do you need to talk to a pharmacist? Or do you feel uncomfortable when buying certain drugs from the pharmacy? Do you want your drugs to be delivered to you at the comfort of your own home or office? Then it's time to download the Dragnet app, spelled DRUGNET, from the Play Store or the App Store to enjoy total convenience. Use Dragnet, your #1 online pharmacy. For further inquiries on Dragnet, call 024 00 24455.
Memamo akwa badeba Tema Christian Eye Center aye share enihu apomudin sam nyina seye akwala seye penyin yewo a doctor for kukudam a wombe to womobo aye mpensen mu ne hwehwemu ansana yehu nia ehawe ni no yaye ne ese seye de boa ma wonso weni ne ho tono yewo ndro apapapa ewa ha a chese ye hwe a ubenya ne nyina bi wa ha se efa no ahwehweniwa a friend lenses enso a your quality lenses, any frames.
This center is devoted to eye care. We treat patients with all types of eye diseases here: cataracts, glaucoma, refractive errors, and retinal issues. I am a glaucoma specialist here at the Tema Christian Eye Center, seeing patients particularly with glaucoma and cataracts.
Yeah, war Tema Committee 1. Ye be Methodist sorry no. Ye juma fiti ajwada ye Monday kopem memninda Saturday.
Tema Christian Eye Center, changing lives through proper eye care.
Thank you so much for staying tuned. You are watching Ask Your Pharmacist. Today we are coming to you from Teshi Mobile, and our guest pharmacist is Farm Mariam Apreku. She is the pharmacist at HealthLink Hospital, and our topic for discussion is gonorrhea. Farm, how are you?
I'm great. You?
I'm doing very well. Gonorrhea, ooh. That's a very sensitive topic. What do you think about it?
Well, it's sensitive because we know what it's involved. Just because it involves the genitalia, that's why we think it's sensitive. But then we should also note that it's one of the most prevalent STIs amongst the youth, and even just it cuts across board. So that's why we want to take care of it today, and also concentrate a little bit on the women when they have gonorrhea, and the kids as well. So when you see me, you know I really like dealing with the kids sometimes.
All right, so there you have it. It's very imperative that you learn more, so please stay tuned.
Okay, if I tell you me can gonorrhea some question be na wo mami.
But gonorrhea in the obana gonorrhea le ye ni kan awo yin ye amama kan awo yin dani wo na gono shiga ye kan awo kon wo na na kan.
Okay, 80 answer me the be ma oni say oba betimi de gonorrhea ma be ma so betimi de gonorrhea ma oba obi atimi e de ma ne yonko
debi ba ni sa goloni ni are ndie efi oba nu oba yo le yo le gonorrhea ya ageke amehye ka amehye na ga twa bibi ani cha no ni ka fi egbu ogbam ka egbu ogbam ni wona gonorrhea ona no ye ama me ga gonorrhea wo yin ona ni bia na egbege bi ne ba 13 years 12 years ame fe ame 13 years 12 years fe ame fa ame she chachai bia ne ame fe ame jala onu padi 13 years 12 years ame fa ame jala onu padi bia ne ka agbepe kege ye fo ye fenfo age se mini o be sugun bi aha me gbe ka ha me gbepe kege ye fo ye fenfo age mini o ame a chop money ye shin odugba kege ame ge ska sukun gbe bi na GPS SGO mene kege ame ge ska la me
okay dem person bi sa won say mpacho ede na de gonorrhea no ede ba
so gonorrhea eye moawa your friend bacteria na sa bacteria na your friend Neisseria gonorrhea ene ye science asem but sa moa no na de ye ne say etimitina obemem oye oba nso a oba ayase ewo ho etimi krampo tina wanum etisa na akoye etisa moa no so ebo ma wo betimi dia akoma obi ana wo betimi dia sign ne nyonko a eya mrepi na ye enemu eyare enti ya na your friend STDs that means sexually transmitted diseases that means eyare a ni obi da wo betimi enya enti se enye
infection abotimi enya wo emunu say oni like say bia obi na won na ekuhia on so betimi anya
ampa sa pepe ti sa moawa no yes bacteria mo no na di gonorrhea bas problem with wo gonorrhea na yin say white no hu sunsuanso na ma ni nya no eni gonorrhea ne de ne se enti won say obenya gonorrhea kra obetreat white sa so oba bitimi ka say be treat me white sa enkoda ba white no so ya na de
me wife no white no I said like white no say first no nan kan tisa bet say ofa flu and na onya sa
it's ofa flu no dia aya ma bebre mu fa flu white de ehu ba o mo ho pa no kre no if it's our immune system na dey akọ form ti bo say na white de bia ha o mo sa enti no de won ti me say gonorrhea but we question na obi say any white ni ye penny there bi but ya na any white symptoms no na so so ne ye pe enti ma ne bebre mu gonorrhea kra de o mo hu enti no ne de wo ho that's it. Today we are talking about gonorrhea. Gonorrhea is an STI and it's caused by a bacteria called Neisseria gonorrhea. And they will hire babaso ho asem. Babaso. Yete babaso be mpe bebre ne adwene ko mema ne so mu no mutenya babaso. Ba ntesa problem ne say babaso more be your friend in Neisseria gonorrhea and de babaso eba. So what happens that when you get gonorrhea, what are the symptoms that will really crop up? Let's go to the men first. For the men, they might have some itchiness in their penis. And if they're having itchiness there, sometimes too, they feel the burning sensations. Why? Because what happens is that the gonorrhea bacteria stays there. Remember bebre ni so munya baba swade e ba ne say omo be me mu hyehye omo anasa omo dwonso omo sensio fitaa bi di etire anansio yellow ebo omo krampa e green enti oyesa na be mema no mu hu se oba we na me ben ni na menya asa yare we enti e ho na ntempa na no omo pe enro e dia edai asa obo omo gonorrhea na problem ni say aya omo entwa omo ni san ko hwe ma na sabi omo ni omo hia na omo nya asa gonorrhea e say ye kai se gonorrhea e ye nnemu yare eye nemu yare ni de se ka ye boy ho ban a ye betimi prevent gonorrhea woni so say so ba tan ewo a obetimi di gonorrhea amaneba ebu o mekra akwala na onya gonorrhea na oyefunum na emo memra wo no afa wa ya ase no akwala na ni etimi ka gonorrhea moa wa ni bi wo wase enti akwala na beba no especially akwala won ne foforo no be sori no na ne ni nyina aye empen eno so ese ma ye ni ko ho wo yo ba tan no wo foforo na wo ba eni ye empen bebreba and temper or midwife. So we've already looked at some of the symptoms of gonorrhea in the men. I talked about the burning sensation and the discharges after urination. And sometimes they also have some inflammation in their testes. Ubo safe de na ne show abano ba ko etimi ye de eye kese na eye ne ya. And also ma wadwene nko so say enye de bia na gonorrhea ba oti no obememu. Ebo mo a otimi ehunu or sure ni mun so kakra momi enko ma no so de no problem e wo ma a omunya gonorrhea ni say e ma dodo na ye fa mu 60% kra wo ha omu hu so mu gonorrhea da enya de omani be hu kra ena problem ni say ma de bia ni insio free aseba eda ni de nyina ye hu ne makakra wo ya say e bo man nkeka ye bi ba eno na ye fa ne white na candida enso se gonorrhea nso nya e ba wo so a wonya gonorrhea sa eniema ne bia ene nsunsuanso ana symptoms a ye hu no gonorrhea mu enti ne ma ne bo ma mo beka se oh sa eniema na de bia to me ne da anti o ma dwene kra nkoso ko se se bia be me bi de ne ho beka no ansa na be ma ne hu se menya sa problem we enti problem ni se me ma ni su ho a ye ni ayenim o mo sample enko o mechi enko kan kire sa ma we mo so enkonya help mommy enko complications. Let's talk about the complications of gonorrhea. Let's go to the men. What happens is that when your gonorrhea goes untreated for a long time, there are instances where people start treating gonorrhea with a lot of herbal medications. Of course, I'm not undermining herbal medications, but sometimes if you realize that after 3 days and you're not seeing any improvement in your herbal remedies, why don't you go to the hospital or see your pharmacist and go the orthodox way? There are proven ways that you can eradicate your gonorrhea in less than a week. Yes, less than a week, a minimum of 5 days. So if you leave your gonorrhea to stay untreated for a long time, especially in the men, you know that it can lead to infertility. Because remember, gonorrhea can affect your testis area. And you also know that gonorrhea can affect your lungs. Yes, if you have gonorrhea of the lungs, you can actually get lung diseases and you can die. Also, you can also have gonorrhea infections in the mouth, and it's quite difficult to treat. So if your gonorrhea starts, as soon as possible, notify your sexual partner, do trace contact, and try and solve it as fast as possible. Don't wait for it to get worse, because the more it gets worse, the more complications will arise. So let's take care of ourselves in that aspect. Let's go to the women too. What happens with the woman is that sometimes this gonorrhea bacteria, they will migrate to your fallopian tubes. Ekobasa unya gonorrhea na echena won hwani ye ti se man ye ne afana. Etimi ekọ baby a wotu nkosua ni mpo. Any baby a wa wode ne eda no na afi de ama wa wo ho ayeden. Enti ma bebre no, especially so uye obi a wo start enya enamu nkita hodie ntem a won say gonorrhea na atena ho acha. Enti by the time I wode bi a 30 na opesa wo no na gonorrhea and edidi wo ho awie etimi kra asai awawo de etimi san so cause bibi e friend PID, pelvic inflammatory diseases. Kaya yare bia de bia etimi ma wa ya se eye wo ya gonorrhea enso timi de sa de ne ba enti mo ma ye nhwe se enam se ye enamu eyare ni ti ye wo betimi dia control condom e wo ho condom ne betimi a prevent gonorrhea, especially when obi a woni ni nyankita ho da woni ni kwa kohia esa wo bo ho ba with condom. Remember say so wo fa contraceptive e bo ho ba ya sane ma wonyem. Remember say sane ma no fa ma wo prevent gonorrhea. Sane ma no fa wo betimi nya gonorrhea. The idea betimi prevent wo from getting gonorrhea e wo condom. Eno nko ani idea betimi prevent gonorrhea. Any HIV, any more wa e friend STIs no. Into we baby say e dey na betimi ya nya sa gonorrhea yi. The dey kan pa ni say won worry ya ana say won ye ready say won obi betena ya ene ni pa ne krampo enkoda eno ne friend abstinence na say ba say won timi nse ho so a onua condom wo ho fa condom no baby a onam bia sanya wo protecting wo from HIV no sa na say protecting wo free gonorrhea enso ho na wo baby say won say enu be kra na etimi di treat gonorrhea no kra say enu bebre wo ha di treat gonorrhea ebi ye mpane ebi tablet. But problem I say urban say in noni bebre kwa e treat gonorrhea and say so enye adwuma it's a man for enum noni basabasa eno na e friend bacterial resistance no but eno no ye be kan ho asem echire it is all called pharmacy a ebo ma pharmacist no obema wo nnuro bi na wanom obeka che osanom na bia na watching hwe se wo num ni ye obetimi so ma obi bia be ma odwonso no so ayede aye enema esa wo yen so a wo betimi wonya gonorrhea no ne say senior so when you hook up for be wo ha obet no no nko ane hu ye and then you can say be faithful to your partner na ko ba say wa anye faithful na momo ko ti gonorrhea ya re ni bia e say wutimi nya akukudro na say nipa no do ne senior wo say wo do ne nko ade a say wonya akukudro na wonya nipa temama nipa no na ma na adwene ba so say oh e bia makwa ye bibi say e won chen na ya re we na menya kebeboa say obedi mechi na makon pharmacist na me ko hu no na obema me no wako hospital say baby a me call ye no enra e de ma me no doctor so no obekasa so obema obi a no wa ma obi obesesa ne so a ye besesa no so ayedey amam na woni mu say sometimes the obinya gonorrhea sani yare ba could be ebon your friend chlamydia. Sometimes people who are usually affected with gonorrhea, it comes together with chlamydia. Remember, chlamydia has the same symptoms as gonorrhea. So sometimes you find your doctor or your pharmacist giving you treatment for chlamydia when they are also giving you treatment for gonorrhea. Do not be alarmed. They are just taking precaution because they've realized that in most cases there are co-infections of the gonorrhea plus the chlamydia, and they have similar symptoms. So they might as well treat both of them so that you'll be free. Remember, take care of yourself. If you are having unprotected sex, make sure you are protecting yourself. If you are with a partner, be faithful to your partner. And if you can't really take care of yourself and you don't want yourself in all this stress, why don't you abstain? It's also one way of preventing gonorrhea, you know. Take care of yourself. You will see ourselves another time.
Memamo akwa abadeba tama Christian Eye Center a yehwe eni ho apomudin sam nyina seye akwala seye penyin yewo a doctor for kukudam a wombe to womobo ayem pensem mu nhwehwemu ansana yehu nia ehawe ni no yaye niese seye de boa ma wonso weni ne ho tono yewo ndro apapapa ewa ha a chese yehwe wi a ubenya ni nyina bi wa ha se efa no ahwehweniwa a friend lenses enso a your quality lenses, any frames.
This center is devoted to eye care. We treat patients with all types of eye diseases here: cataracts, glaucoma, refractive errors, and retinal issues. I am a glaucoma specialist here at the Tema Christian Eye Center, seeing patients particularly with glaucoma and cataracts.
Wo Tema Committee 1 ye be Methodist sorry no ye ejuma fiti ejuada ye Monday kopem memninda Saturday.
Tema Christian Eye Center, changing lives through proper eye care.
Alrighty, so it's time for a social media question and farm. The first question is, I am 28-year-old woman and recently my boyfriend has been given medications to treat gonorrhea. I would like to know if I should also start taking some of the medications.
Okay, so then I'm going to assume that you are sexually active with your boyfriend. And then again, I'm also going to assume that you are not using protection. If that is so, you are not supposed to actually take the medication of your boyfriend. You're supposed to see your pharmacist. You are supposed to go to the hospital. Let them actually diagnose you that you have gonorrhea, because note, your boyfriend might be having symptoms. That's why he rushed to the hospital and goes those meds. You might not be having it. But what happens is that sometimes you'll be having some co-infections, especially the women. So your medications might differ a little bit from your boyfriend. So when you go, they are going to put you on maybe different meds altogether or similar meds, but definitely they might add something to it. So don't share in his medicine. It's totally not yours. Go for your own. Talk to your pharmacist, talk to your doctor, discuss the whole thing and see how you go about it. Yeah.
Okay, so do not self-medicate. The medication might differ, so always ask your pharmacist if you're not too sure. The second question is, I was treated for gonorrhea when When can I have sex again without infecting my spouse?
Okay, so you realize, let's assume we are talking, this question is from a male. Okay, so what happens is that most of the time the males have this gonorrhea, they have the symptoms, they start getting their medications. He's asking when he can start having sex with his spouse. No, you have to put your spouse in the know. Fine, sometimes we all know why they can't. Maybe there was cheating somewhere. But the most important thing is if both of you know, you really have to discuss it. It has to be frank as possible. If only you care about your spouse, make sure they are also in the know, they get their meds. And when you're on your meds, sometimes it's best you abstain from sex whilst you're on the meds. And if you can't, you have to have protected sex. I mean with a condom, okay? And even with a condom, you have to make sure you use it for at least 2 weeks after your meds, okay? So as not to just cause cross infections between you and your partner. So yes, it's difficult, but your spouse must be in the know. And if you're on your meds, just make sure that you're abstaining from sex. And if you are not abstaining from sex on your meds, you're having protected sex, and at least it should go on for at least 2 weeks to a month before you can resume normal sex without protection. Yeah.
All right, there you heard it. To avoid cross-contamination, please make sure that you are having protected sex. If you're not too sure, always ask your pharmacist. Dose for Healthy Living is up next. Stay seated. We'll be right back.
Today on Dose for Healthy Living, use water as a chaser for your medication. It is usually best to take prescription medications with a full glass of water. This can help prevent stomach irritation and improve absorption. Don't take them with soft drinks or grapefruit juice.
Coffee now or hey, a sharp on to an asio.
Madame Yario, and my renti, minting PM Cotedro.
Oh, coffee, and an hour how home. Uber to me at all, no, you know, or dragnet up no so I won't 209.
Dragnet?
Ah, name dragnet, me, having home be a woe. And one is a macro up no so much children ram here, you know. And now my friend pharmacist no name Jimmy, or the rolling you know, Bremen, I watch him 5 CDs pet.
And yes, where the mammy want to be Buddha?
Emerson also download the Dragnet app free Google Play Store and now App Store nenya ahoto so papa bi. Dragnet app there for the tombia edi kankra.
Memamo akwa abadeba tama Christian Eye Center a share eni ho apomudin sam nyina seye akwala seye penyin yewo a doctor for kukudam a wombe to omobo ayem pensem mu nhwehwemu ansana yehu nia ehawe ni no yaye niese seye de boa ma wonso weni ne ho tono yewo ndro apapapa ewa ha a chese ye hwe a ubenya ni nyina bi wa ha se efa no ahwehweniwa a friend lenses enso a your quality lenses, any frames.
This center is devoted to eye care. We treat patients with all types of eye diseases here: cataracts, glaucoma, refractive errors, and retinal issues. I am a glaucoma specialist here at the Tema Christian Eye Center, seeing patients particularly with glaucoma and cataracts.
Yeah, war Tema Committee 1. Ye be Methodist sorry no. Ye juma fiti ajwada Monday kopem memninda Saturday.
Tema Christian Eye Center, changing lives through proper eye care.
So this is where we draw the curtains for today's episode. I really hope you learned a lot. This show was proudly brought to you by Dragnet, your #1 online pharmacy. Download the Dragnet app on Google Play Store, the App Store. Always speak to a pharmacist on the app. You can upload your prescriptions, have it delivered to you wherever you are. With Dragnet, you are always assured of quality, convenience, and affordable drugs. Dragnet, your #1 online pharmacy. This is also brought to you by the Pharmaceutical Society of Ghana and Tema Christian Eye Center. For all comprehensive eye care services, please contact them on 024-371-7468, or you can locate them at Tema Community 1 adjacent the St. Paul Methodist Church. Tema Christian Eye Center, changing lives through proper eye care. This show is also supported by Seafood, the best vitamin C plus zinc supplement from Samuel's Pharma. Many thanks to our media partners, ETV Ghana and GH1 Television. Like I always say, whatever that goes inside of you is merely irreversible. Always ask your pharmacist for the best treatment and you will never ever regret it. Alrighty, my name is Peggy Sano. I'll be coming your way sometime next week. Until then, be safe and it's bye-bye for now.